So I'm going to show you a picture that kind of shows you the frontal bone and its two bone markings or surface markings, so you can see what I mean when we say that. So this is a picture that's on the blackboard under Pictures for Lab 4. And so A here is asking for the name of this bone that's on the front of the cranium. And so the name of the whole bone is called the frontal bone. And then these little arrows are pointing to the two surface markings. So this one is pointing to the surface marking that's called the supraorbital margin. So that whole margin of that bone there is called the supraorbital margin. And then this is pointing to a tiny little hole. It's a bit difficult to see with this picture, but there's a tiny little hole there. And so that little hole is called the supraorbital. You can call it the supraorbital foramen or the supraorbital notch, either one. So that's what we mean by, identifying the bone and then identifying some significant areas on the bone or surface markings. All right, so I'm going to go back to our lab packet. And the next thing I'm going to let you know about is that you'll notice that there's terms that are used often when we are talking about surface markings. So you can see the term foramen, you can see the term process, meatus, fossa, condyles. So you'll see those come up pretty often when we're talking about surface markings. So it's a lot of times helpful to know what they mean so that you can more easily identify those structures. So like, for example, foramen means a hole in the bone. So foramen means a hole in the bone. A process, it means something that is projecting off the surface of the bone, kind of sticking out. So they like to call that a process. Fossa, that means there's like a depression in the bone, so like a little depression in the surface of the bone. And condyles, generally they use the word condyles to represent an area where a joint occurs, so they'll use the term condyles. So you do have those terms in your textbook, which you can use. And again, it's just helpful to know what those mean. We don't specifically ask you, like, what does foramen mean? What does that mean? But if you know what they mean, if you start picking up on what they mean, then it's a little bit easier to, because a lot of times they're half of the name of the surface marking. So it's a little easier to know what to call those structures that you're identifying. So I'm going to show you on our Blackboard site. So I was under Pictures there. I'm going to go back. And then if we go to, oops, I'm going to go back one more time because I'm still under Pictures here. So if you go back to this spot where you have the videos and the pictures, at the very bottom, close to the bottom, there is a little handout, and I'll click on that. And I have a list of those, like foramen, fossa, meatus, condyle. You can see all those. And then they have like kind of the description of those. So that's where you can, if you're not sure what those mean, you can look at the description, and then it makes a lot more sense why they're named that. And there's some more down here as well. And then this also has some, if it's helpful, some handouts, to help you with identifying the bones that you're going to learn about in this lab. So if that's helpful, you can use that too. All right, so that is a little tip on how to proceed through this lab a little bit easier. Okay, so those are the cranial bones. And then the facial bones we went over. So now I'm going to jump down to, there's two more objectives that kind of focus on the skull. So the sutures, those are those structures. Let's see if I can find my pictures again. I took that picture down. Let me go back here. So on your skull, you will notice that there are these yellow or orange lines, and what those are called sutures, and that's where the bones of the cranium and the face, where they connect to each other. So those are actually joints in your head, those little sutures. So depending, there's a lot of sutures, but there's 4 of them we want you to identify on the on our cranium. So these are the 4 that you're going to identify. And then the other last objective over the cranium is the fontanelles. And the fontanelles are commonly called the soft spots. So those generally are just present when we're infants, and then they will they'll become hard, become all bone, and they won't be soft anymore. So these are those structures that allow for the infant's brain to grow, and so it will grow kind of with the infant. So they stay open for a couple years after birth. So we do have little fetal skulls, pictures of those that you can find. There's a lot of fontanelles, but we just want you to know these 2 here. And again, this is where you can call it an anterior fontanelle, if that works, if you remember that one. Or if you want to call it a frontal fontanelle, you can do that. But you don't have to call it both. So, okay, so after the cranium and the face, then we have the vertebrae. So you will need to know the vertebrae and their names according to where they're located along the spine. And you also need to know how many there are. So definitely, you know, the cervical vertebrae are in your neck. You should know there's 7 of them because you eat breakfast at 7. And then the thoracic vertebrae, those are the ones that the ribs are attached to, and there's 12 of those, and you eat lunch at 12. And then the lumbar vertebrae, there's 5 of those. They're in your lower back. And then you eat dinner at 5. So you will need to know the location of those particular vertebrae. And then the vertebrae continue, the spine does, but when you get to the sacrum, those bones are not individual bones, they're fused together, so we call them just together one bone, the sacrum. And then the coccyx is the last part of the spine, and so there's 1 coccyx, depending on the person. But all right, so you will need to know that, and then a couple of other structures that you can see on the spine too. But then this part up here is where you will be responsible for knowing, if you look at just at any of our spinal bones by themselves, not connected to each other, they have certain parts that you can identify. So you'll be identifying those various parts on them. So there'll be a hole in the middle of them. That's where the spinal cord goes. So it's called the vertebral foramen. And there'll be an arch above that vertebral foramen, so they call it the vertebral arch. So and again, there's pictures of those as well as videos that go over those. And then the last page of our lab packet is over the sternum and the ribs. So again, the sternum and the ribs are the bones, and then you do have structures that we call surface markings that you need to know that are associated with the sternum, and also ones that are associated with the ribs. And then when it comes to these questions, that's how they'll be on the exam too. So you should know there's 7 pairs of true ribs, and there's 3 pairs of false ribs and 2 pairs of floating ribs. And the difference is the true ribs bind or attach to the sternum directly. The false ribs attach to the sternum indirectly, and the floating ribs do not attach to the sternum. So those questions will be on your practice test as well. So, all right, so that is your lab 4, and don't forget to do once you've learned the material, go back and do the practice test. Let's see how many there are this time. Yep, so there's 4 practice tests to do for your assignment before next week.